this is Cailey Wulf, and today I'll be talking to you about COPD. So what is it? It's chronic obstructive pulmonary disease, which refers to a group of diseases, emphysema, chronic bronchitis, and in some cases asthma. It's progressive but can be partially reversible airflow obstruction. So this is a small airway disease as a result of inflammation, excessive mucus creation, and bronchial wall thickening. It's preventable and treatable. So here's a picture of what I'm talking about. We see the bronchioles coming off the bronchus and the alveoli at the end, all inside the lung. And then quickly, just here on the right, you can see that bronchioles lose their shape and become clogged with mucus, and the walls of the alveoli are destroyed, forming fewer large alveoli. And then another example, you can see there's smooth muscle contraction on that bronchiole, which causes airflow obstruction. There's airway remodeling and fibrosis, alveoli hyperinflation, and then that alveolar wall destruction and loss of elasticity. So how does a person get it? It's caused by asthma, chronic bronchitis, emphysema. Smoking is a huge one. Almost all COPD patients, either presently or in the past, have smoked. Air pollution, being over 40 is a risk factor, chemical fumes, dust. And then there's also a rare genetic condition called alpha-1 antitrypsin, or AAT, that can cause COPD. How does it affect a person? A person with COPD is going to have dyspnea with chronic cough, mucus production, wheezing, chest tightness, and recurrent respiratory infections. Then as it gets worse or progresses, skeletal muscle dysfunction, nutritional abnormalities, and weight loss can be seen. So prevalence, in the U.S., COPD is the third most common cause of death behind cancer and heart disease, and it's estimated that about 12 million adults have COPD, while another 12 million are undiagnosed or developing it. And then I just threw in this little map here so you can see the prevalence is actually pretty low in North Dakota. It's about 4.4%. So who most commonly gets it? Those aged 65 to 74, non-Hispanic whites, mostly women, lower income status, and then once again, if you were or are a smoker, 90% of COPD patients have lung damage from smoking. Medications typically prescribed: bronchodilators, inhaled steroids, combination inhalers, oral steroids, phosphodiesterase 4 inhibitors, theophylline, or antibiotics. Okay, so this first paper, immunomodulatory effects of two different physical therapy modalities in patients with chronic obstructive pulmonary disease. They compared low-level laser therapy and inspiratory muscle training on inflammation, which they measured with interleukin 6 and T lymphocytes measured by CD4 and CD8 markers. So the study had 40 males, 55 to 65, with stable COPD, that were moderate smokers, so they had a smoking index of less than 400. So this was a random blind study for about 8 weeks. So what happened was there was a decreased interleukin 6 with increased CD4, CD8 in both groups, with the low-level laser therapy being a little more significant. So there was a negative, moderate, significant correlation. So both of these modalities can be effective in promoting immune disturbances, so they both decreased inflammation. My next study, determination of exasperation predictors in patients with COPD and physical therapy, a longitudinal study. They looked at to determine the predictors of exasperation, either alone or in combination, in patients with COPD who have received physical therapy in the last 6 months. So this was an observational, longitudinal, and prospective study with 63 COPD patients, either in stage 2 or 3, that entered a physical therapy program consisting of 3 assessments over 6 months. So they looked at many things, but what they found was that over a 6-month evaluation with patients with COPD, there was a 5% significance with distance walked in the 6-minute walk test, and a risk of exasperation depending on BMI and fat-free mass between the 3rd and 6-month evaluation. So basically, tolerance to exercise measured by that distance walked in the 6-minute walk test can be used to predict the risk of exasperation in patients with COPD. Relevance to the top 20, we talked about oxygen transport, lung disease classification, respiratory control, diffusion, and compliance, and that can all be related to COPD. And then here are my references.